All right, welcome everyone to Mentor Moments. This podcast is hosted by Maryville University's Rehabilitation Counseling students and the Missouri Rehab Association Eastern Chapter. I am Dr. Michael Keener, one of the hosts, here with Brayton Wooters, one of our current students. Brayton?
How's it going? My name is Brayton Wooters. I am one of our students here in our program. Really, the vision and the goal behind this podcast is to allow students and those in the profession of rehabilitation counseling or counseling in general, just to get a better idea of what the field looks like, what the profession looks like out in the real world, and also just to get just advice from those who have been in the field, that have been doing this career for a while, and just learn more.
We look forward to interacting with you on a fairly regular basis, so please keep tuning in. Thank you.
On today's episode of Mentor Moments, we have Liz Ewert with us. She is a certified rehabilitation counselor and graduated from Maryville University's Rehabilitation Counseling Program in 2020.
Currently, Liz works as a vocational rehabilitation counselor for the state of Missouri, and she works in the downtown St. Louis office.
So Liz, we want to thank you again for coming on to Mentor Moments. Could you just give the listeners just a little short bio of your career?
So my career started so I graduated from Maryville's Rehab Counseling Program in May 2020, so at the height of the pandemic. After I graduated, I did have a job offer, but that didn't really pan out. So whenever a position opened up from another student that I was in the program with Missouri Voc Rehab, I jumped on the opportunity. So I have been working with Missouri Voc Rehab in St. Louis downtown office location since August 2020. I've been here for about a year and 2 months now. So my primary caseload, I work with individuals that have severe and persistent mental illness. A lot of times those individuals have co-occurring disorders. Those could be substance use disorders. Most of the time it's substance use disorders. And so I'm like the IPS counselor in my office, which is individual placement with supports. It's one of our most supported employment programs that we have with Missouri Voc Rehab. And we partner with agencies. My particular ones are VJC and Places for People. So I partner with employment service providers with those agencies. And so we just really help individuals that have those substance use disorders, and they also have the severe and persistent mental illness. We provide employment services to them, like job supports, placement, and everything like that. So I also started working with another site, which is called Jefferson Spaces. And it's a pilot, it was a pilot program. And what it is it's a homeless community, which it's transitional housing. And a lot of those individuals, actually, it was kind of funny how some of the clients that I've had on my caseload ended up living there. And it's been a fantastic experience because a lot of the clients that we have in our programs, we lose contact with them. And so if we lose contact with them, we tend to have to close our cases. So this has been a wonderful way of us to keep in contact with those clients and to be able to provide some additional supports for them. It's been really productive, and it's actually about to grow. So I kind of spearheaded that whenever I first started here. So it was something that my supervisor talked to me about, and then we went and kind of toured the facility. So it's a tiny home community, so it's something that's a little different. But it's wonderful. It's been wonderful.
Thanks, Liz. I mean, I can hear and see your voice, that you're sort of excited and passionate about that. And I guess I sort of have a follow-up question, because you're still relatively, I would consider you a recent grad, but yet obviously you have experience. But think back to when you first started. Do you have started in the rehab counseling program? Do you have a tip for a new student that
So I know that sometimes whenever we have grad panels, a lot of times that's usually for students that are maybe in practicum and internships. But I would definitely encourage even new students, even if it's your first semester, if you hear that there's going to be a grad panel, I encourage you to attend those type of meetings, because you never know what might come of it. You might make a connection with another grad student that was in the program, and you might end up finding out that they're doing something that maybe you didn't think about, and that could be something to help you down the future to get a practicum, get an internship, something like that. So.
Well, if I can give you some more props, Liz, that's something that you did throughout your program, and even coming to before you were a member of Missouri Rehab Association chapter. I remember seeing you coming to some of the socials, and then again attending the events, and you took every opportunity to meet new people in the field. So you get A+ for that.
That actually came from advice from a different professor when I was in my undergrad program. They told me that, sometimes it's a good thing to say yes to opportunities.
Awesome. 2 good tips. Say yes.
Could you let us know a little bit more? Could you tell us a little bit of just something that people might not know about you, or about the kind of career that you have, or just kind of what you do on a day-to-day? What's something that would surprise our listeners?
Something that might surprise some listeners is that I was in the Navy for 9 years. I was in the Navy, and actually my career ended because of a disability. The reason why I'm sitting here in the seat was because I went through the VA rehab program, and they paid for my way to go to Maryville Rehab program. And I'm sitting here today because someone else took a chance on me.
Wow. I can see how that passion would transfer over to what you're doing every single day. That's really amazing. I love that.
Yeah, I would agree. And that's something in my experience. I've seen many veterans who want to give back to the veteran community. And I know you're working with, in the public side, Liz, but I think that's the same transfer. Okay, kind of pay it forward way of thinking and operating.
Yeah, and actually it's been a good way for me to connect with some of my clients, because some of my clients are also in they've been veterans. And so a lot of times I've had individuals or clients where they're a little bit more guarded initially, and I already pick up that they have had service, and then I wait until the right moment to bring that in, and then it just it clears up any guarded behavior that they have with me, and all of a sudden they just open up. And it's been something that's been very helpful in my career so far, and it's been helpful with other counselors if they may have a veteran, they're not really sure how to work with the client or maybe have that conversation. It's been pretty helpful, but very productive too.
Great. Sort of transitioning again, now we're talking a little bit more deeper about working for Missouri Voc Rehabilitation. Tell us maybe some of the few great things about, again, working for Missouri VR. To put you on the spot, I know your supervisor is also one of our graduates, so I'm sure working for Kim Chaplin is a good thing. But I guess teasing us. Right. Teasing aside, what are those, again, for, especially right now, everybody is looking for people, and it's sort of the new employees market that they can really sort of shop around to get sort of maybe the best offer, or look at the best perks or, benefits. So what are those great things about working for Missouri Vocational Rehabilitation?
Well, as some individuals know, whenever you're in the program, you can take the CRC exam while you're still a student. And what the great part is about working for Missouri Rehab is that, those things that are called continuing education, a lot of times you have to pay money for those. Well, you don't have to pay money for those with Missouri Rehab. They offer them all the time. They even have a training platform called Bridge Training, and they have pre-recorded training videos that you can watch, and you can earn some CEUs from those. A lot of them starring Dr. Keener. But yeah, they offer CEUs all the time. there's a lot of trainings that happen, even with the MRA conference, VR actually paid for me to go there, and, they paid for me to have a hotel room and attend some of those breakout sessions, which I earned CEUs from that. So yeah, it's just the continuing education has been phenomenal with this job. So there's definitely those perks, and of course there's the perks of we have great supervisors in our my office specifically, but also in VR overall. They really care about your professional development, and they'll offer opportunities for that. So even if you haven't gotten your LPC and that's something you're going towards, they offer supervision. So
Yeah, I guess that even that last piece, I know we always sort of advocate with our students when you're negotiating for a job, will they provide supervision? If they don't, maybe will they sort of compensate you if you're getting supervision outside of the agency?
And I think they even pay for your certification tests too.
Awesome. I guess on a similar question, I know, as you know, this podcast is in conjunction with the Missouri Rehab Association Eastern Chapter, and you're also a member. So can you talk a little bit about why you joined MRA Eastern Chapter, and maybe what are some of the benefits of belonging?
So one of the benefits of belonging is that you get to be with Dr. Keener a lot over Zoom meetings. No, teasing aside though. So again, they offer a lot of socialization opportunities. I know, especially in today's world with COVID, that's been something that I struggled with. Graduating from Maryville at the kind of the peak of the pandemic, and then coming into this world, you don't have a lot of opportunities with connections, and so it really allows you to network with other professionals in our field. And honestly, it gives you an opportunity to get ideas from other professionals in areas that maybe you're not too familiar with, to figure out how you might be able to help a client that may be on your caseload. And it just bridges some of those connections. And we also have fun doing it. So why not join?
We just say yes, right? Going back to your tip, sometimes you just need to say yes, right?
You can make a lot of great friends in this agency, and with MRA there, I mean, we have individuals that are with Paraquat, with Mercy, MERS. I'm sure there's a lot of other ones that I'm not familiar with that I'm probably still going to be learning, but and it's also just great to put on your resume too,
So you mentioned the MRA conference earlier. Could you just let us know a little bit more about what that is and what that looks like?
So the MRA conference is, so the location was over at Tantara, I guess it was a resort, and that's Margaritaville. So it has a lot of, wonderful things that you can do after hours, obviously. But so they have the opportunity to again, have continuing education credits. I know I went to quite a few. I went to one with Dr. Keener, which is solution focused, and that was a great refresher from school from Maryville, because Dr. Keener and the Maryville program is really good about solution focused type therapy, and so it was just great refresher. But I also went to one that was in dealing with individuals with autism, and there was one sentence that really helped me out a lot. And it's like, whenever we're talking about clients, we always talk about appropriate versus inappropriate behaviors. And I didn't realize how negative that actually could come across, especially when you're dealing with a client. That may be something that they would be very defensive about. And so they were teaching us about expected versus unexpected instead. And I was like, that would be something that would come across a little bit more positively. And so I started changing the language I used, just with clients that, not even clients that are on the spectrum, but just clients in general. Because a lot of my clients, again, they're severe persistent mental illness. So a lot of times they're going to have behaviors that are very unexpected. And I feel like that comes across a lot more positively. So.
Yeah, I love that language shift.
Yeah. It's really strange how communication, like language, can really just change a perception of a conversation. So.
language has meaning, right? So
Absolutely.
it, like you said, it can define or pathologize or be negative, but then also it can be empowering and positive and life changing.
Okay, so I mean, those breakout sessions are just a way for you to gain more knowledge and maybe learn something that you never thought about. So again, we have fun.
And have say yes and have fun, right? So
and again, you're even still meeting individuals across the state, not just, we have Eastern Chapter, which is here in St. Louis, St. Charles, and everything, but that's for the whole state. So you're going to meet a lot of people throughout the whole state. And honestly, it's great to be able to see people in person. So that was an opportunity for me to be able to meet some fellow grads in person again. I actually got to see Tiara James, who's another fellow alumni, and we hadn't seen each other since before I graduated. And I think the last time she and I had actually seen each other in person was like March of 2020, and that was right when we were like, okay, everybody, you have to go home. So it was just great to be able to connect with people and just meet some new professionals.
Yeah, awesome. Yeah, I mean, I think what I'm hearing too, Liz, is that graduating isn't the end point. It's really just another beginning or a new beginning. That there's always things to learn or refine or engage with. So,
or even just allowing yourself some more networking opportunities, because you never know. Again, you shouldn't limit yourself to what you're doing today. You should always be thinking about how can this mold me better for the future. So.
I love that mindset of yours, Liz. All right, so obviously the podcast is called Mentor Moments. So this is your time to shine, Liz. So take a few minutes and what is your mentor moment to share with, again, students, early career, experienced professionals? What advice do you have for them?
So I kind of alluded to this a little bit in the beginning of this podcast, and I told this to the alumni or the students during the alumni panel, but even if you have an idea for what you want to do in the future, don't limit yourself to just, okay, I'm interested in voc rehab, so my internship is going to be with Missouri Voc Rehab or Illinois VR. Don't limit yourself with that. Even if you think that you can't do counseling, like clinical counseling, if there's an opportunity that comes up, take it. Because whenever I was in school, I was just like, well, I don't think I can do clinical counseling. I have this stuff from my past. I really don't think I can deal with it in the future. Or, I really struggle with being around a lot of people. I don't think I could do group counseling. But guess what? I had an opportunity to do it, and I did well. And honestly, that's what led me to be able to get this job. I never thought I was going to be having kind of, I guess, a niche for working with individuals with severe and persistent mental illness. I never thought that I would have a job dealing specifically with that kind of group, but apparently I've flourished at it. And I actually really enjoy it. It gives me a lot of great satisfaction, and that wouldn't have probably happened if I didn't say yes to being a group-focused counselor with Centerpoint. That wouldn't have happened. I don't think if it led me here. And if I would have limited myself to just voc rehab and then voc rehab and then voc rehab, I would have missed out on some opportunities for learning. And so I feel like if you have an opportunity that you aren't sure about, try it out. This is definitely the time to try it out when you're in the program, because when you get out of the program, it's the real world out there, and you need to find a job. And a lot of times it's going to be more challenging when you're trying to find a job to say no to something or say yes to something, realize it's not for you. So this is definitely the time to do that.
Liz, I appreciate that. It reminds me of something Dr. Bertolino often says is like when students entering the program, have an open mind. Again, maybe it goes along with your other tip of just say yes, that you sort of does it. We don't really know where life will take us or where that practicum when you network or where that will sort of branch off and take us. So wonderful words of wisdom there for us.
Hopefully. But yeah, and also take the advice of the professors. They know what they're talking about.
Well, Liz, we want to thank you one more time for spending your afternoon with us and allowing us to get to know you better, sharing your nuggets of wisdom. And we want to just say thanks one more time.
All right. I appreciate you guys giving me the opportunity as well.
Awesome. Thanks, Liz.
Welcome. Bye.
Thank you for listening to another episode of Mentor Moments, hosted by the Maryville University Rehabilitation Counseling Student Organization and the Missouri Rehab Association Eastern Chapter, also affectionately known as Merks and Mar, like cookies and cream, Merks and Mar.
If you want to learn more about our program here at Maryville University or just rehabilitation counseling in general, we want to encourage you guys to follow us on social media. You can follow us on Instagram at rehab_Maryville, on Twitter at Maryville Rehab, or on Facebook at Maryville Rehab Counseling. If you want to learn more about the Missouri Rehabilitation Association Eastern Chapter, you can log in online on mraeasternchapter.com to get more info, and we look forward to seeing you guys next time.
All right. See you then.